Hi, welcome to Social Research Insights. My name is Kamakshay Masnuru. I am Principal Consultant at Social Research Insights. Social Research Insights is not a business organization, it is just a freelance training outfit. We are just a group of individuals who are working on freelance style. We have a lot of content related to data science, analytics and IoT. All the content is free, however we have a request. Please consider scoring for staff development programs, faculty development programs in your institutions and organizations. This is in fact one of my demonstrations which belongs to a series of presentations related to healthcare analytics. I'm right now talking about, I'm giving tutorials on a particular topic called healthcare quality improvement strategies. In my previous videos I've explained a couple of models and theories which are directly related to the quality improvement strategies. In this video I'm going to talk about how to perform data analysis around a particular concept called the cycle time. The cycle time is one of the important aspects in healthcare systems because it is directly related to patient care outcomes and also the effectiveness of the performance of the healthcare systems. There is a lot of literature online. You can just go through and study some of the statistical tools and the data analysis techniques. I found some typical techniques. One of the techniques is the patient flow analysis. Anyway, I'm not going to talk about that technique in this video. I'm going to use my own approach because I am expert of R and Python and a couple of other tools. I'm going to show you how to do analysis on patient time or patient visit cycle time using R programming language. I have some data, and in this data we have, let's say 1, 2, 3, 4, 5, 6, 7 data variables, and this data obtained from some healthcare information systems. And the last variable, if you observe, this is actually the outcome. This is actually the perception of this patient, whether he is satisfied or not. So patient satisfaction is one of the critical aspects to determine the efficiency, effectiveness of the healthcare processes in any given healthcare systems. So now we also have other variables like the time taken at the pharmacy, time taken at the billing desk, and time taken for the clinical interactions, time taken to wait for the clinical interaction or the clinicians, and then time taken to process the documents at the front desk, and total time taken. So this total time taken is none other than the sum of all the times taken to process a particular patient in a given hospital or healthcare system. And we are going to analyze this data set and see if the outcomes, which is the dichotomous response organized in two different levels, level 1 yes, level 2 no, and we are going to analyze whether the patient satisfaction really depends on the time taken to process the entire visit of the patient. In short, we can say patient visit cycle time. I have this data in R programming. I don't know, I should say the time df. I think I don't have. Okay, no problem. I'm going to show you how to import the dataset, and after that we are going to perform a particular data analysis technique called generalized linear modeling. Special emphasis on the logit modeling or logistic regression. The entire concept belongs to regression analysis, and we are going to perform the regression analysis, especially the logistic regression, using the R programming language. My first step is going to be how to import I'm going to deal importing the datasets to the R language, and later I'll perform the generalized linear model on the data, and finally we are going to evaluate whether the data fits this particular model, and we'll take some decision whether this data really helps us to understand the total patient visit cycle time and impact of this particular time on the patient satisfaction. Now to import the dataset, I'm going to create an user object that is timedf. It is just any name. You can use any name to define your object. Read CSV. I explained these functions in my previous demonstrations. Please go back and see. File, choose. You can also give the path to get the data. When we execute the statement, I'm using Linux. I think no Linux. The distribution name is Ubuntu version number 16.04. This is called the Nautilus window manager. So when we execute this statement in R, I think this is open, so I can go back to when we execute the statement, our editor, which is RStudio, opens the Unity window manager, and we can just go down to a particular directory, and there we can get the data set. I saved my data here in this path. So time studies CSV, I think this should be the, I saved my ODS. This is actually the LibreOffice CalC application in which I have my data set. I saved this data in the form of CSV, and that is the way we import the datasets into our language. Okay, now let me go to the console just below the script file. I'm in the left bottom pane in RStudio. Names, time df. So let's say, let me open editor time df. I think edit, I'm sorry. This is the inbuilt spreadsheet view application in RStudio. So we have this variables, total time taken to process the patient. This is called as the patient visit cycle time, and processing as the front office desk. Waiting time, I mean this is the time taken by the patient just before going to consult the consultant, clinical consultant, and the time taken to process the patient by the clinical consultant. The name of this variable is CI, and time taken for the billing, time taken at the pharmacy, and the satisfaction, patient satisfaction, as in the form of the variable outcome with the name outcome. So this is in short the description to the. Now we are going to fit a model, and the model goes like this. So let me explain you by taking my whiteboard application in Ubuntu. My model is going to be like this. I am going to use the multiple regression and using a special technique called GLM, that is generalized linear modeling in alpha plus beta 1, the time 1, time type 1, and beta 2, time type 2, this is 2, and so on and so forth, and finally beta n and time type n, and finally error. This is the standard error, whatever it is. I'm sorry, I'm not good at writing, and moreover I don't have the writing pad, and this is just an application, so you have to excuse me for my scribble, the murky appearance of my scribble. Now this T1 is going to be the variable number 1, that is processing time taken at the front office desk, and the second one, T2, is going to be, the time 2 is going to be the time taken by the time taken to wait for the clinical appointment, clinician's appointment, or clinical consultant's appointment, and CI is the time it's T3, T4, T5, and finally the outcome is going to be the dependent variable. So coming to our data, so Y is going to be dependent variable, which is a dichotomous outcome. This is a dichotomous variable in which we have the responses yes or no, which means are you satisfied, are you not satisfied. So these are the two levels of the response. When a patient says yes, it simply means that they are satisfied. If they say no, they are not satisfied, something like that. Is equal to alpha plus beta. This is a beta 1 times, it's not times actually, beta 1 is the coefficient, of course I can say times, processing time, plus beta 2. Next is going to be waiting time, and beta 3. Next one is CI, I mean the time taken by the consultant to finish his job, which means all that communication, discussion, and finally giving the prescription, everything right from initiation to the closing of the talk, entire communication that happens between a doctor, which means a clinical consultant, and patient. And now the billing, beta 4, and we have billing, and finally beta 5, pharmacy, time taken by the patient to the pharmacy. Now there are some assumptions to make. We are assuming that the underlying distribution is a multivariate normal distribution because we have a lot of quite a few variables here, so we should imagine that. However, I did not perform any normality test, so I just assume that maybe I may make the separate video on these assumptions, but for time being let's assume that the underlying distribution is multivariate normal. And moreover, we are going to fit a model assuming that the patient satisfaction depends, significantly impacted by the total patient visit cycle time, patient cycle time. And moreover, we are going to concentrate on which one is significant in affecting the patient satisfaction. This is very, very critical for this particular analysis. We are just going to find out the variable, the time variable, which has statistically significant impact on the patient satisfaction, name of which is outcome. So now let us jump into the action. For that we have a beautiful function that is GLM, the generalized linear modeling. Yeah, of course. Yeah, this is GM because in we have another function LM, that is for the simple linear regression. However, we have our dependent variable is dichotomous variable, which means the responses are two. We have two responses or two levels for this variable outcome, so we need to go for the generalized linear modeling. And in this we are going to fit, as I said, we are going to use a particular scenario called logistic regression. So first let me put my dependent variable outcome, I think outcome, yes, correct, or just let me use this because I may do the mistake, and now that little tilde, which means we are going to start the left hand LHS RHS of the regression formula, and I just make a simple equation, the format or the formula without much ado, which means the simple regression with a single plus sign without using. There are other formats to perform the regression in R. We can use star, just like this, that is interaction effect, and we can also use colon, that fits the entire assumptions of the regression format. But anyway, you just go through, there is a lot of material online. You have to read little bit about defining the equation for the formula for the regression in R. I'm just going to make a very simple way of performing the regression, logistic regression, by using the function GLM. Now the second one, CI, let me next plus billing, let me plus pharmacy, which is the time taken by the patient at pharmacy, and finally we have to let R know where is our data. So our data is there in the time df, and now the format, what is the family of the distribution that we are assuming below the underlying distribution. I think this is the distribution which we are assuming for the dependent variable. So we are assuming that since we have two responses in our dependent variable, it is reasonable to assume binomial distribution. So I call family is equal to um, we need to write the is equal to binomial, and in which we need to put the link function, that is logit. I think that is sufficient for now. Our binomial, okay, let me press okay, control enter. Oh, beautiful, we got the output. Now let us dwell upon the results or the outputs that we produced by performing the general linear modeling generally by performing the general linear model or our format, that the outcome depends on the different types of time taken to process the patient while he or she visits the healthcare system. Now going to the intercept, we are not really going to talk anything about the intercept because we don't need this. We are only going to concentrate on the type of relationship that since I said we are going to evaluate the level of impact or the relationship between impact of the time over outcome, which is patient satisfaction. We just have to pick up the beta values. The very first coefficient, this is a coefficient for the processing T, and this is negative. So the satisfaction, when satisfaction increases, the patients are likely to decrease, would wish to decrease their time to spend on processing the front office desk in hospital. So they don't really like to stand before the desk or sit before the desk, or really don't like to spend time with the front office people while they process their documents. This is very important to get them ready for the clinical interaction. But this data shows that the patients really don't like to spend more time before the front office, in front office, and that really impacts their satisfaction. And now coming to the waiting time, it has a positive impact over the patient satisfaction, but I don't think this is sufficient enough to impact the satisfaction. Anyway, we are short enough to declare whether it is statistically significant or important or not, but we can gain some certain insight that the waiting time has a positive impact. Of course, patients would like to wait for some time just before they enter into the clinical chamber. Before they meet the clinician or clinical expert or the doctor. Maybe a number of reasons that is a separate discussion. Maybe we can make the patient wait and feel pleasure outside the doctor's room. We have really very interesting and different strategies to do that. So in this data, patients may forego the waiting time just before meeting the clinical staff, that impacts positively. And now clinical staff, I think this is the most positive impact on the satisfaction. Patients really would like to spend more. So when they, since this is a logistic regression, I can say the increase of response, which means if the patients really would like to move from dissatisfaction to the satisfaction, they really expect to spend time with the clinician. And one global observation is that this is the maximum, this is the variable which has the maximum impact on the patient satisfaction. And the waiting time before meeting the clinician and waiting time and the time they spend with the clinician, both of them have positive impact, and rest of them, none of them really have any impact on the, they have the impact, but they have negative impact. And I don't think the patient really want to decide to spend time in front office and for billing and also in pharmacy. But they would like to wait. They don't really think to wait before meeting the clinician, and the time they spend with clinician has the most impact on the patient satisfaction. So that is what the data speaks. And in case if we would like to know more about this particular data set, or what's really happening here, because because we only know the type of the relationship and the impact, but we don't know whether it is statistically significant or not. So for that, we can make use of a particular function called summary, and close the parenthesis and press Ctrl Enter. Since we are in the, now we have additional information in the summary, that is the p-value. Of course, the intercept is very significant. I mean, the fixed effect in this data is really significant, but none of them are significant. So I don't think, though we have some certain effect of time spent before meeting the clinician and while before the clinician, or have the positive impact over the satisfaction, but they are not statistically significant, so we don't really think much serious about them. But whereas when we come to this processing time, so the time that which represents the patient's time spent in front office, it has a negative impact on the patients, but it is statistically significant. So hospitals or healthcare systems really need to think about the time that which is spent. I mean, in this data, as far as this data is concerned, the hospital, the data which is gathered from the hospital, that hospital need to think about there is something really wrong with the processing time, that is the time taken by the patient in the front office. They don't really want to spend time in front office, and I think the healthcare system or the hospital need to devise some strategies to get rid of this. Perhaps the time, we don't really have enough information to come up with the conclusions, but however we can just gain some insight that the hospital need to think seriously about the processing time. But whereas though there is some positive impact of the time taken by the patients just before meeting the clinician or clinical expert, and the time spent while they are in communication with the clinical expert, though they have the positive impact on the satisfaction, but they don't really seems to be statistically significant. I don't think this is that important for formulating a strategy, or maybe important for may not be important for the decisions. So this way we can study the patient visit cycle time, which is very, very important for the quality improvement strategies. This way we can perform the analysis around this particular concept. I hope you I think you like my, if you really like my video, please press like, and kindly don't press unlike. Subscribe to my video channel. Stay tuned for the new content. Thank you. Thanks a lot.